So with that, I'm going to turn it over to Irwin Garfinkel, who, with his colleagues, Jane Waldfogel and Heidi Allen, looked at the status of the profession and scholarship around social policy.
So thank you, Mark. Thanks to all of you for coming after a long conference. And I hope that what we present will make your effort worthwhile. So the paper that I'm doing is Social Policy and Social Work in the 21st Century, and with two co-authors, Jane Waldfogel and Heidi Allen, neither of whom are here, but they have expertise in areas that I don't, and made very important contributions. So our charge is to assess the condition of social policy research in social work at the dawn of the 21st century. We also say a little bit about the state of the profession in terms of influencing policy. Just focusing on the scholarship for a moment, it's a daunting challenge to, and Mark hinted at this in his comments, to assess the role of social policy research and social work, because the field is so broad. Includes obviously poverty, anti-poverty research, child welfare, health, aging, housing, neighborhood and community development, anti-discrimination policy. Some would say still criminal justice policy, although we're not intimately involved in that anymore. Tax policy is relevant as well, and gender policy. So, and I could go on. That's a partial list. So the question that we faced, the first question was, what do we do? What do we talk about? So our solution was to focus on only 3 areas. And the criteria for choosing the areas, one, that the areas be, everyone would agree that the areas we choose are central to social work. A second and more pragmatic was that we have some expertise in this area, and that's why we have 3 of us. I have expertise in the broad area of anti-poverty policy, or generally social economic well-being. Jane Waldfogel has expertise in child welfare, and Heidi Allen expertise in health policy. The method, which I'll come back to at the end, you should think of what we're doing. It's in some ways novel. I hadn't thought of it being novel initially. But what we do is focus on what we think are really seminal contributions coming from people in social work. And so we focus on just leading research in these 3 areas. I'll come back to that and say the limits of that at the end of the talk. And to summarize the findings, social work scholarship is remarkably strong. And I'm an optimist by nature, but I hope to convince you that that's not just a reflection of my personality, rather it's a reflection of the evidence. So I'm going to begin with anti-poverty policy and economic well-being more generally. Again, the vastness of the literature just in this area requires narrowing. And we've narrowed to 4 areas: core poverty research, child support, asset development, and comparative research, cross-national comparative research. With respect to core poverty research, I'm going to begin with overarching research on poverty. And here, the first thing I thought about was the Institute for Research on Poverty has published, I think it's now 4 volumes on fighting poverty, confronting poverty, understanding poverty. There was a 4th. But 2 of those 3 were edited by Sheldon Danziger, who was a member of the faculty at the University of Wisconsin in Madison. And these were, at the time they were published, must-reads for people who took seriously scholarship, were interested in overall scholarship in poverty. And here I'm going to divert a little bit to the state of the profession. So again, I think very impressive. 4 of the 13 directors of the Institute for Research on Poverty came from social work. The only profession that has a stronger representation, economics. Same thing with respect to, there's now a National Academy of Science panel charged with coming up with how do we reduce poverty, child poverty, by half in the next 10 years. Again, 4 of the 15 National Academy of Science members are social work, come from social work. Again, the only profession that has stronger representation, economics. Poverty measurement, I'll just talk about 2 contributions there. One is as I think probably most of you know, that in 1995, the National Academy of Science recommended that we adopt a new measure of poverty as opposed to the official measure. Lots of weaknesses of the official measure. I will focus on only one, which is the official measure doesn't count the benefits from the programs that we have actually expanded the most, especially with respect to child poverty. So, food stamps is not counted. The earned income tax credit is not counted. Public housing is not counted in the official measure. Finally, in 2011 or 2012, the Census Bureau published a supplementary measure of poverty, the SPM. And I'm going to talk about the OPM, that's the official measure of poverty. They didn't replace the official measure. It's called supplementary measure. Again, lots of differences. I'm just focused on one. It counts all these benefits, And a group of us at Columbia University, myself, Jane Waldfogel, a student at the time, Liana Fox, and a research scientist, Chris Weimer, and there are 2 or 3 others, co-authors. What we did was to take the SPM back in time, historically. So the Census Bureau only published data for the teens. I think they go back to 2011, but we took it all the way back to 1967. And the difference in the reduction in poverty is dramatic. If you look at the official measure, the trend in child poverty is actually child poverty goes up a little from 67 to the current period. If you use the SPM, we reduce child poverty by more than 40%. That's a very different narrative. The first narrative is we threw money at problems, it didn't work. The second narrative is that money was well spent. It was very effective in reducing poverty. Second area, and by the way, that was cited in the President's annual economic report of the President on the occasion of the 50th anniversary of the Declaration of War on Poverty. There's a chapter in that report of the President, economic report of the President, that looks at a 50-year look back on the war on poverty, and our work is central to that. Material hardship, social workers have made seminal contributions on material hardship. I remember when I first, the concept was invented the measurement was first done by Sandy Jenks. The first couple times I saw it, and I had a student in class that I poo-pooed the measure and said, well, I'm skeptical about it. I was dead wrong about that, and a number of people from social work have published very convincing papers on why this is a good measure. 5 minutes? I thought I had 30 minutes. Oh my God, okay. Well, enough said about economic insecurity is perhaps a better measure. So, all right, I'm gonna go through this quickly. Child support, I've made some contributions in that. Dan Meyer and Maria Kansian at the University of Wisconsin have made seminal contributions. In this area, in child support, I would say the contributions from social workers dominate the literature. And moving ahead quickly to asset development. So yesterday we gave an award to Michael Schroden for his work in asset development. As I've said to friends and colleagues, he makes me look like a piker in terms of what he's done in asset development. I don't want to say he and his students and colleagues are the entire literature, but it's pretty remarkable contribution. Comparative research, Kahn and Kammerman using the Luxembourg income study. Again, social workers have made incredible contributions there. Modern case studies, we have some remarkable examples. Chin Gao is sitting in the audience there, has done a study of China, China's DeBao system. It's the largest public assistance program in the world. And Jane Waldfogel's book on child poverty, it's not child poverty, Britain's War on Poverty. Again, remarkable, important study. Child welfare, this is our area. We have the professional, it's like maybe we should curse God for giving it to us. It's the hardest area, but we have it. We have it. And the scholarly contributions have been remarkable. There are people sitting in the audience here, Jane Waldfogel. You can look down the list. This is just child maltreatment and child protection, but also if you look at foster care, guardianship, adoption, and independent living, again, very impressive. A couple notes on the current state of scholarship in child welfare. You can read them. We'll come back to them if you have questions. On to health policy. Well, health policy is an area which we deliberately chose because it's not an area where we've had this kind of influence, but it's an area where social work is playing an incredibly big role and a growing role, and scholarship now is beginning to emerge. Especially in the area of, one way I think about health policy and the role of social work is that a lot of health problems are not best addressed by health professionals. They're actually best addressed by social workers because a lot of the issues about health are not just health profession related. Okay, I'm going to skip over that quickly, and so I think two interesting developments in health is that we now have a chance that there may be a National Academy of Science panel created that would take a look at the role of social work in health policy. And I'm going to skip that, and skip that, and skip that, and I'm just going to go on to the conclusions. So, scholarship is strong in anti-poverty research and child welfare, promising in health policy. In terms of policy influence, I would say the professional role is mixed. We have a very prominent place at the table, but what we've actually achieved, we should only view it as limited. It's not that we've not achieved anything, but we've not achieved what we aspire to, and we need to work on that. With respect to past and future success, I would say the keys are, and if you go back and look at the slides, you will see one is to remain up to date in research skills. Second, to hire scholars from different disciplines, and I would say especially economics. I have a little bias. I'm a half economist myself, but I think it's not just bias. I think if you look at the contributions, working in interdisciplinary teams, I think that's essential. And if you looked at the items that are listed, you'd see an enormous amount of interdisciplinary cooperation. Create or play leading roles in research institutes and laboratories. I think I began with the Institute for Research on Poverty. I think you will see institutes scattered across the country that social workers are involved in. I think that's essential for our continued leadership. And second, I think, and this is something we are very good at, comes naturally to us, which is collaboration with government and also with foundations. But I think the collaboration with government, us being a practice profession, makes it a natural even when we have bad government. So limitations, the methodology is unique. You could say focusing on first-rate papers to make the claim that social work research is strong, in some way there's an element of tautological, but here's the thing, we could have come up empty. That is, there could, if we use that as the test, there could have been no papers. And the contrast between health, where we have less, and anti-poverty research, where we have more, is. And second, the focus on our own expertise raises the question is, are our findings generalizable? I think the answer is yes. I think all across the country in different areas, you will find first-rate contributions from social work, but that's a hypothesis. I don't have the evidence. I didn't present the evidence. Lastly, let me say it's a preliminary draft, and look forward to feedback, first from Marah and then from the rest of you. So, thank you.
Thanks much, Irv. Yes, we have Marah Curtis from one of the institutions that Irv was talking about, as the Institute for Research on Poverty, as our discussant.
Hi. So I had the benefit of reading the whole PowerPoint slide. So maybe you'll get some of it in the context of my comments. So this was a fun and interesting task, what Irv and colleagues were charged with doing. And so in thinking about providing comments on something like this about the nature and state of social work research and policy in particular, and areas of competence and areas moving forward, it's a big question. Yeah? So I thought about it in this way. Policy practice in historical context, that's what I craved. I craved that. I craved a bit of historical context, and I kept thinking about the fierce urgency of now, like the times we're living in now, in reference to where we have expertise historically. So what was the author's charge? What they were charged with doing was to assess the conditions of social policy research in social work at the dawn of the 21st century and make recommendations for future success. It's daunting. I agree with Irv at all. It's a hard thing. Social policy research is very broad, poverty, child welfare, health, aging, housing, neighborhood and community development, anti-discrimination, criminal justice, tax and gender, and others. And so their approach, as Irv outlined, was to focus on 3 areas that are central to society and social work, and I would add, existing expertise and developed infrastructure, structural relationships, trust, and historical practices. Okay? And so they came up with these 3 pots: poverty, child welfare, and then health, with newer research focusing there. Okay, so it's a big task, so then I wanted to restate it. I wanted to change the question slightly so it was yummier for me to think about, okay? So I would restate the challenge a bit more broadly. I think there's a number of ways to approach thinking about this task, both conceptually and practically. Okay? So it's overwhelming, and it's overwhelming for what I think is a good reason: the breadth, depth, and function of social policy research and social work. It's conducted by social work scholars or in and on systems delivering social services, and by a wide range of actors within, allied with, or produced by an agency or for a governmental need or for policy research findings. So that function of how folks are doing their work determines in part the questions asked and the policy process. Okay? So let's think about those 3 core areas that Irv pointed out: poverty, child welfare, and health. Okay? Particularly for the first 2, there's no doubt in both the present and current historical dominance of social work scholars in these areas. And what I'm struck by, which makes my point, okay, is as Irv was talking, he's talking about this person who we trained, who then went over here, and this person who knows this person. So you see how the focus of the training around a particular substantive area, and then where people go into different systems, and then the potential for that collaboration over time, even out of interest area. I think that matters. So I think about history, opportunities, because I'm a hopeful gal, and expansion. I want to know why. Why dominance in child welfare, right, in particular? Why dominance in child welfare? Why dominance in poverty? It wasn't that folks sat around necessarily in a linear fashion and said, oh, I'm going to take on child welfare. There's a particular history to each one of these developed areas of dominance. So, to put more formally, each area of current dominance has a story that combines a seized or facilitated presence in response to an observed social problem. Right place, right time, research labor opportunity, professional policy practice dominance, governmental change that needs to be delivered or evaluated. And it's a confluence of these different pressures, and then the expertise is developed. Okay, so I just felt like I could think a little bit about history because I like to. But so then I took a little time rereading some stuff and thinking about who doesn't want to think about Frances Perkins? Who doesn't want to think about Frances Perkins? Her time at Hull House, her time in New York State, an architect of the New Deal. Okay, Harry Hopkins, and then where he goes. Right? And so that's an older example, but that example of how these folks interacted in these different functions, different roles, and different systems, and then went into different systems. And then when they needed to know something about something that they didn't know, there was someone in their network, in their system, who did know that. And so then they reached out across and abroad. Okay, so here's my challenge, what I hope that we get someplace with today. What are the opportunities? What are the new opportunities? Have a concerted attack on the basic structure of the welfare state right now, and norms of democratic process opened up for social policy research and practice. Thank you. I don't have the answer to this question, Irv, but I want to entertain the question, because what I become concerned about, what I am kept up at night about, pedagogically when I'm teaching, but also when I'm thinking, is that I know how to think about, right? You know how I was trained to think about the world, but I don't know what I don't know, and I don't know who I don't know. And that lack of knowing that means I might miss opportunities that combine the political context that we're living in, and maybe there's practice dominance in an area, but it doesn't yet have infrastructure or research infrastructure, but maybe it's deeply important to the profession, the nature of the democracy, or the unraveling of our welfare state. I want social work to be there. I don't want to lose any of that we're doing, but if there's new places, I want to know that I know what they are. So how do we take into account the fierce urgency of now that will ensure we have maintained and expanded the reach of our professional presence and policy practice, and have some kind of method for understanding how to incorporate the time in which we're living so that we have methods for not missing the next core areas of dominance. And under 5 minutes. Yeah. So here it is. Thank you. Yeah.
That'll keep us busy for a while. No, great. Thank you very much, Marah. So we have time for questions, comments, and all I would say is I would ask you to keep your questions or comments to 1 minute or less. That's actually a fairly long period of time, and it'll allow us to have more. And if nobody comes up, you can continue your question after that, but for now, let's do that. And please identify who you are and where you're from.
Is this on? Yeah. Okay, I'm Bobby Everson from the University of Pennsylvania. I am a self-proclaimed ethnographer and do work with low-income families and economic mobility. And I have statements more than questions, but I don't want you to forget Diana Pierce's influence on the supplemental measure with her self-sufficiency standard. Her work was quite notable in influencing that measure. And I also want to really encourage us beyond generalizability to the depth and the substance that can take place in terms of policy influence by qualitative work. And my work in particular has had quite strong policy influences, which has really that's the satisfaction of it. So keep on with what you're doing and extend it, and thank you.
Hello. Do you want me to introduce myself?
Yeah, please.
Okay. Lena Nepomniachtchi from Rutgers. So this is a question that I don't know if anyone can actually answer, but my concern over these last years that I've been here in the profession is the lack of focus on social policy across many schools of social work. As most of you know, I think many of us experience the same thing. Most of the students that are coming in terms of the master's programs, are not interested at all in social policy. They're all interested in clinical work. And this is, I think, a problem. So I'm just curious about what your thoughts are on that.
So actually, I'll address both of the comments briefly. So I think qualitative work is very important. I focus in the paper on quantitative work, but that is not to disparage the qualitative work at all. It's also the case, I think, that there's nothing new about the disproportionate focus on practice as opposed to policy. But I think that all schools, as far as I know, of social work require policy in their curriculum. And whether we should do more, that's a good question. It used to be, I just speak of my own university, that we had a year-long social policy course. That was certainly the case at SSA when I got my master's degree. It was year-long. We're now down to one semester. So I think there is an issue, and maybe we could and should be doing better.
Hi, I'm Charles E. Lewis Jr., and I have a nonprofit, the Congressional Research Institute for Social Work and Policy, and what we do is try to engage social workers on the Hill, and if possible, to bring research that would have some impact on legislation. I'm currently working with Michael Schroden and with his child savings accounts, and we're actually negotiating with Congressman Crowell from New York, who introduced the bill in 2015 to see if he can reintroduce that bill with a few revisions that Michael is trying to put into it. But we're on the Hill trying to change policy or influence policy. My question is, how much do we ensure that our research will have impact on policy? Is the policy driving the research, or are we doing research hoping that it might have some some policy implications.
Do you want to say something?
Well,
Also, Irwin Garfinkel was my dissertation chair.
so I wanted to just say something. Lena, where are you, Lena? So you know what I've come to with that idea in terms of with the math. I'm teaching undergrads now with the master's students. Is that all of these master's students, regardless of their preferences, are policy practitioners because they are street-level bureaucrats, right? And so I frame it that way, and then I frame it within the context of the code of ethics. It's not, and they seem to be takers because I think for social workers who are practicing, it's really very hard. They're going to go into state agencies, and they're going to be asked to deliver policies that are dead set against the code of ethics. And we're in essence asking them to hold to the line. It's not direct, but that's what I've done with it so that I have some bit of peace with it. Because it's a hard thing to do, right? The piece about the research. So don't you think, Charles, it's both, right? I mean, so sometimes we're producing work, because I'm at IRP, right? And there's in this relationship with the state. So sometimes we're producing research work that the state needs to do what it needs to do. And maybe it gets used and maybe it doesn't. And then we're doing the other parts of our job. Other people have deeper knowledge in this. But I think about it as I always look for the sweet spot because I don't want to do things I don't want to do, and I don't want to do things I don't think matter. So when I'm in the room with people, at least, and these things are negotiated, I try to find the sweet spot where the problem conceptualization and the product that we're going to produce, if it's shared enough, one would hope that the results then are, listen, that's how I experience it from where I'm sitting. I don't know what other people think, but.
Joan Zlotnick, a consultant to NASW, and have had the opportunity over the last 30 years to work in 3 social work organizations at that intersection of research, policy, practice, and education. And I also had Irv as my social policy professor at the University of Wisconsin only 40-some odd years ago. But I was just kind of delighted, and I guess I sort of took a breath of fresh air when you said that actually our social work's impact on social policy in these areas was good, because I feel like in my 30 years, there's been so much sort of denigration of the profession and what the profession does, and there's so much good work going on. And so I think valuing that and honoring that and lifting that up is a really important piece. And just to address some of the issue around policy and integrating policy throughout the profession, and your comments are well taken. Over the last years, one of the many initiatives that's gone on in social work has been this sort of coalition to promote policy, education, and practice in social work. And about 8-10 months ago, the Social Work Policy Institute and NASW held a summit really looking at this issue and what we needed to do in terms of the political landscape. There are action briefs, resources, and a full report from that can be very helpful as schools of social work that aren't that strong and conscious in attracting students who are really interested in policy, really want to look at how within field research, practice, policy can be better integrated, including what we're thinking about when it's in Washington, thinking about coupling the conference with some Capitol Hill briefings and things like that. So thank you.
Hi, my name is Cassandra Simon. I'm at the University of Alabama. I am not a very eloquent speaker, but I usually am able to get my point across. I have an increasingly growing concern about the really active role of social work as a profession and our role in social justice and advocacy and activism. And so since this particular piece has to do with especially policy and policy practice, understanding that we all have to operate within the environments in which we live, and that it's really nice when we can find the sweet spots and we can find that shared part. But I am finding from talking to other people who have these same kinds of issues, and we just had a special interest group here at SWIR on social justice in social work research, education practice, and education practice and the profession, about obstacles that are being put in our way to actually teach students how to engage in legislative policy change. Yes, I am in a very red state. I am in a state that was and continues to be the last stronghold on Jim Crow laws and trying to continue to perpetuate those in different ways. And we are being blocked from using university resources to allow students to try to effect legislative policies. So not being able to use university emails to promote, to push forward petitions, to spread those petitions to all of our constituents. We're being encouraged to find outside ways to do that and use outside listservs to do that. And so how can we really teach policy practice if we're not able to really have students, when they have an opportunity, to actually try to change legislative policies that are on the table, but we can't actively engage in it because, well, we don't want to upset the donors, we don't want to upset the legislators. And I'm like, I see increasingly that we as social workers are no longer leading the charge for social justice. We get on the backs of issues that are safer. We get on the backs of issues that are popular at that time. When I entered the profession, it was because I thought that we were the profession that would lead the charge to try to effect change, that we would be the ones in the front with the banner. And it seems that now what we are doing is just waiting for it to be a hot button issue, or for it to be something that is relatively safe. And again, understanding that we all have to operate, we all need our jobs, we all, need a roof over our head and food to eat. But I am very, very concerned about the profession as a whole and what it is we are becoming and not becoming anymore, especially in terms of issues of social justice, advocacy, and activism. So.
So I really want to hear what everyone has to say here. So my take on the current, that's what I mean about the times in which we're living. So the risks are disproportionately borne, right? So scholars, depending on the university, depending on what you research, depending on whether or not you were tenured, what your track is, depending on whether you're at a state or a private, the risks are disproportionately borne to do the work. I recognize that profoundly, and that is very much the truth. And so I think then the question then becomes for me, what is the professional response to the fact that it's disproportionately borne by those of us in the academy, depending on where we vary across those 4 different domains. And the risk is very real. I'm at a state system. My syllabus has been FOIA'd. You can get it on my, these are chilling things. These are real things. And I feel what you're saying, and I feel that sense of fear and worry and all of that. I think it's the context of the times that we're living. And when I get together with other scholars across discipline, across university, some experience it more than others, depending on the region of the country that they're in, depending on if it's a public or a private and all of that. And I don't think we've talked about that as a profession or academics at all. And it is disproportionately borne depending on the kind of research you do and the populations that you work with. I don't have an answer. I hear your problem. I share it. And it's disproportionately borne by the profession.
I agree. I actually have a question that I'd like to ask you. So you mentioned we should invite economists into our fold. Of course, we have economists. But one thing that's happened over the last 50 years is, in fact, there were no schools of public policy when the National Conference of Social Work started. In fact, there weren't any for many years thereafter. And this is sort of contested professional turf now. And I'm just kind of wondering, you alluded to some of this, Irwin, Marah, you may have some thoughts about this as well, but we've got a couple of minutes. What do you think about that? I mean, is this something we shouldn't think about, we shouldn't worry about? I know I have students that are told by faculty in schools of social work, well, if you really want to be a policy scholar, you should go to, in their master's program, are told you should go to policy school. So I haven't studied that empirically, but that issue, I'm wondering how you respond to that, and what do you think about it?
I think that's bad advice. Schools of public policy are potentially a competitor, but they're also potentially collaborators. And I don't fear them. I don't, again, that may be a personality trait, but I think there's plenty of room for them and for social work. And I think we have some comparative advantages over schools of public policy, which, by the way, are old. They weren't called schools of public policy. They were called schools of public administration, and they were a wing of political science. What's changed is they've hired lots of economists, and in some places they're dominated by economists. But they don't have the practice background that we have, and they don't have the close connection to practice that we have. That's one. And second, they cover a vast range. So social policy for them is just one minor field, And I want to return to the Marah's comments, the fierce urgency of now, because I think Marah is right, and it reflects concerns that were just raised by, I didn't catch your name. Thank you, yes. Simon said. All right. So, look, we live in an awful environment. We have a president who's a racist. We haven't experienced that. None of us have experienced that in our lifetimes, but we have experienced it historically. It's there. It's at some level, racism is not new to us at all, and it's different because we just elected a black president, and we thought we were doing much better than what we were. So there's no question we've gone backwards. But the scholarship that we are doing as a profession prepares us for when there is an opening, and there will be an opening. Donald Trump is not going to be president forever. The 2018 elections are very important. Things could change, and we have to be part of making that change. So in terms of the fierce urgency of now, it's not scholarship, actually. I think it's advocacy and being engaged in the field. Back to scholarship, though, for a moment, and preparing for when openings come. Right now, in the National Academy of Science panel on reducing child poverty in half, child allowances, universal child allowances, are the #1 policy on the agenda. When I came into the profession was for child allowances. The first paper I published in social work with evidence of a little bit of knowledge being a dangerous thing. I argued for a negative income tax as opposed to a child allowance. Once I learned a little more economics, I realized how flawed the argument I was using, which came from economists, by the way, but was not a correct use of economics. The profession has to be prepared. I think we are. The scholarship in a lot of areas is preparing us for the next generation.
Great. Actually, on that, I want to thank Irwin and Marah on that note.